Everyone, we're going to be learning about mood disorders today. So, the first thing we want to talk about is what is a mood disorder? It is a disorder that affects the way you feel and think about yourself. And there are different types of mood disorders, but the ones that we're going to be talking about today are major depressive disorder, Dysthymic disorder, and bipolar disorder. So those are the three major types that we're going to be talking about today. So let's go ahead and talk about what major depressive disorder is. It is an intense, so some of the characteristics a person with major depressive disorder might have are more likely intense sadness. They are usually distant from others, They may have suicidal thoughts or possibly even attempts. They have a decrease in amount of pleasure, even from things that they usually do enjoy. They can also change in their weight. So they can lose weight, they have a loss of sleep as well, a loss of energy, they might be agitated. So that's some of the characteristics, and in order to be diagnosed with major depressive disorder, you need to exhibit 5 or more of these symptoms. So if you want to remember this disorder, just think of the name itself, major depressive disorder. So you're thinking about someone being very intensely depressed. So that is a way of thinking about it. So our next disorder that we are going to be talking about is dysthymic disorder, which is usually persistent depression. It is milder compared to major depressive disorder, so it's less severe. However, it is long-lasting. So the main things that you see for these patients is that the sadness occurs almost all the time. So I'm going to just write here, it's almost constant sadness. Okay. Alright, so that is one of the main symptoms that they exhibit. But in order to be diagnosed for dysthymic disorder, you need to be sad for at least 2 years. Now, that seems like a pretty significant amount of time, but in order to be considered having a mood disorder, that is the amount of time, the minimum amount of time required in order to be diagnosed with dysthymic disorder. And as well, they do have their triggers, and some of the triggers to this disorder may be rejection or even loss, so a death of someone they care about. So that's dysthymic disorder. There's no really easy way to remember this for a midterm. It's just something you need to just memorize. The name doesn't really give anything away. So unfortunately, yes, you will have to memorize this. The last one that we are going to be talking about today is bipolar disorder. And as you see my little emojis here at the top, well, they indicate something. Because the people that are diagnosed with bipolar disorder, they have 2 cycles that have 2 extremes, basically. So they cycle between euphoria and major depression. Okay? Their symptoms can be similar to that of the major depression disorder. So maybe there's a loss of sleep, maybe high agitation, maybe difficulty concentrating, maybe intense sadness when it comes to the depressive part. So their symptoms are fairly similar. So let's talk about the first extremity, which would be the mania part or the euphoria. This part, it's very hard to concentrate for them. They have abnormally high energy levels. They seem to be very talkative. They may exhibit unrealistic beliefs. And another one could be like inappropriate behavior. The depressive cycle is just basically they are maybe feeling suicidal, worthlessness, helplessness. Maybe they even try to kill themselves. So that is the second extreme. I don't have that listed down here, but that's basically all you need to know for the depressive part of bipolar disorder. The diagnosis for this mood disorder is you have to have an abnormal mood for about more than 1 week. However, you need to exhibit like 3 of these symptoms in order to have like the correct diagnosis. So we just talked about major depressive disorder, dysthymic disorder, and bipolar disorder. And now we are going to just talk briefly about the biological causes to mood disorders. So biologically, there could be a loss in gray matter that is linked to an increased prevalence in mood disorders. So the loss of gray matter. Also, the shrinkage in the hippocampus and the frontal lobe is also pretty prevalent with mood disorders. They also exhibit high activity in the amygdala. And another one would be the high activity in the HPA axis, which just means basically the hypothalamus, pituitary, and adrenal axis. That's the acronym there. So hypothalamus, pituitary, and adrenal axes. And then the last biological cause that I have listed here is like a decrease in neurotransmitters. So some of these neurotransmitters could include like a decrease in like dopamine, a decrease in serotonin, a decrease in norepinephrine, and also a decrease in glutamate. And it is also shown that mania is actually linked with an increase in norepinephrine and an increase in glutamate. So that's just something to note. So therefore, that is all I have for today. I hope that helped you understand mood disorders a little bit more. Thanks and have a good day.